Latest figures, moving on, from the Office for National Statistics show that excess deaths in England and Wales are now currently running higher than during the COVID pandemic. This is a big story, ladies and gentlemen, an absolutely massive story. Health affects us all. It affects us, well, probably arguably a bit more than what's going on in the Channel, frankly. But throughout October, there have been an average of 1,564 extra deaths per week, compared with a weekly average of 315 in 2020, 1,300 in 2021. Let's just break this down for you. More people are dying, excess deaths, than they were during the pandemic. And experts have now warned that some deaths have been caused by, shock horror, collateral damage from the pandemic, as well as the huge backlog of people waiting for treatment. There have also been concerns about the general public simply not seeking help. They're worried about overstretching an already overstretched NHS service. I had a professor on before, a doctor, an oncologist, who said in no uncertain terms that he could see this coming a mile off. When we locked down and we essentially shut the National Health Service down, turned it into the National COVID Service, this was blindingly obvious that this was going to happen, and it was the wrong approach to do. People weren't diagnosed with cancer, people weren't diagnosed with things like depression, various different other illnesses, and lo and behold, we're now seeing the knock-on effects of that. That was his view, but I'm keen to get the view of my next guest, which is the former chairman of the BMA GPs Committee, Dr. Laurence Buckman. Dr. Laurence, thank you very much. Great to have you on the show. Right then, what's causing all these excess deaths?
Mostly it's related to the pandemic and the inability of patients to get through the door, not just the GP door, but the actual, the real door further down the chain. All those people with various illnesses, some of which turn out to be more serious than was obvious at the beginning, and those people should have been sorted out earlier. I don't like the phrase collateral damage, but I certainly agree with your previous correspondent on this, that actually this should have been dealt with in a more timely fashion.
OK, so, look, hindsight is 2020. However, various different people were shouting this from the rooftops at the time. Mm-hmm. Have more people died now as a result of our response to the coronavirus crisis than would ever have died from COVID if we'd have just not locked down? Do you think?
No, I don't think so. I think we would have had more COVID deaths. Whether you agree with the lockdown or not, the fact is it delays the number of people who are going to die of COVID. And the NHS was in danger of being overwhelmed, and the solution chosen was lockdown. We can debate the pro and con of whether that was worth it or not, but the excess deaths were absolutely an inevitable result of turning into an NHS that became a COVID service. It could have done nothing else. The solution clearly was to very rapidly ramp up services the moment the opportunity came to start clawing back what would then become excess deaths. And it was obvious to everybody, including me, and I broadcast at the time, saying, if we don't watch out, this is going to happen. And what a surprise, it's happening.
Yeah. Well, the NHS appears to be a bottomless pit when it comes to money. And we're hearing now about potential strikes for nurses. The ballot, and one of them closes today. Apparently it's going to take a few days or a week or so to count the results of that. So we'll have to wait and see whether or not nurses have voted to strike. We're also hearing about a recruitment crisis. We're hearing about people being overstretched, etc. We also are relentlessly being told the NHS needs even more money. We can point fingers all day long, and I certainly intend to continue to do that when it comes to the mistakes that were made during the coronavirus crisis and our response to it. But it is that horrible phrase, we are where we are. How do we get out of this mess right now? Because it's not good enough for people to go, well, Chris Whitty decided to shove us all into lockdown and now people are dying as a result. We need to sort this out now. What do we do?
I think the main thing we need to do is to operate on what I would call a war footing, or a COVID footing if you prefer, and we need to start delivering service. I'm going to use the phrase round the clock. I don't necessarily mean 24 hours, but certainly over a much more extended day. Well, the reason you can't operate it over 24 hours is because people can't go on working continuously. And even if you work in shifts, there aren't enough bodies. The biggest problem is not money. The biggest problem is bodies. There are not enough medical humans able to do the work to deliver. But we could work much more efficiently if we, for example, operated scanners through the night. I know patients would find it quite funny to come to a hospital at 4 o'clock in the morning.
Well,
And if you've been waiting 2 years, if you'd be waiting 2 years for a scan, I think most people would think, oh, okay,
Absolutely.
I'll do it.
Absolutely.
And why not?
Absolutely, I agree with you. I agree with you. And just on that, Dr. Laurence, because I'm going to have to let you get going, I'm afraid, right now, because we're very squeezed for time at the end of the hour. But I appreciate that. Won't be the last time we talk about this.